You're listening to Astonishing Healthcare, the podcast hosted by Judy Health, focusing on the biggest issues affecting healthcare consumers, benefits plan sponsors, and health plans. We're covering how things truly work or don't in the U.S. healthcare system and pharmaceutical supply chain, and we're doing it in an astonishingly efficient way.
Hello, and thank you for listening to another episode of the Astonishing Healthcare Podcast. This is Justin Venneri, your host and Senior Director of Communications at Judy Health. And this episode should be a pretty fun one, a lighter discussion compared to some of the other benefits-heavy, conflict-heavy, regulatory-heavy, etc. stuff that goes on in the health benefit space. So we're doing this to help, hopefully, all the undergrad and graduate students out there who are thinking about making health tech or health benefits administration a profession, or maybe even those who are thinking about moving over into healthcare. I have Jacob Deal, Lisa Yu, and Brian Sabaraj in the studio with me today, all of whom have gone through our internship programs and ended up with full-time positions within the last year. Welcome to the show.
Thank you for having us.
Yeah, thank you for having us.
Glad to be here, Justin.
So I'm just going to start off. Again, we're going to try and keep it light. Jacob, starting with you, we'll do some intros. Can you share your background? Where'd you go to school? What was your path to Judy Health like? And the third part, what's your current role?
Yeah, of course. So I did my undergraduate degree at College William & Mary, Virginia, go Tribe. And then my first job out of undergrad was in management consulting, where I primarily provided data analytics services to a few U.S. public sector clients. After a couple years of doing that, I pursued my Master of Business Administration at University of Pennsylvania, specifically in the healthcare management major. And during that educational experience, I started my internship with, at the time, Capital RX, now Judy Health. I got the opportunity to work on our analytics team on projects ranging from more operational financial questions to clinical and clinical programs questions. So that gave me a good broader view into a couple different areas of the business. And I was just continuously impressed that all of the people here have a unique combination of deep expertise and passion for the mission of delivering cost-effective care for our clients' members. So I was excited to come on board full-time, where I work on a couple of process improvement projects to continually perfect the way that we serve our clients, and then some supply chain efforts as well to support our ability to provide our clients and their members with the best possible price solution on every drug.
Cool. Lisa, same questions to you, please. Give us a little bit about your background. Where'd you go to school? What was your path to Judy Health like?
Hi, I'm Lisa. I completed my undergrad at Carnegie Mellon University, and I was studying math and CS. And then I came to New York University for business analytics program. And I joined Capital RX for the internship after a year of my grad school. And I was a data engineer intern, and I graduated in December last year and just started last week as an associate data engineer in the data matrix team, responsible for building the data pipelines and clean and process data for both internal and external claims that we have.
Amazing. Welcome to the team. Nothing like putting you on the spot after a week at the company. It should come on the podcast. We can thank Sarah Gans for that, who leads the internship programs here.
Happy to be here.
We're happy to have you. And Brian Sabaraj. Brian, thanks for joining the show. Same questions to you, please.
I grew up in Maryland. I went to college at Yale. I majored in electrical engineering and computer science. At Yale, I really further developed my passion for healthcare. I always wanted to work in healthcare growing up, but I was able to really explore two sides of wanting to be in healthcare, but also really enjoying coding and really enjoying engineering. I found Judy, and when I came on, I was tasked with building out a new observability platform over the summer as an intern. Got that done, and then I joined part-time or my last semester in college, working on the platform team, working on the build system, other optimizations at scale. And I recently joined as a senior engineer, and I moved to New York.
Very cool. Brian, I'll stick with you since you kind of got into it a little bit there. I'm curious, and you said you always knew you wanted to work in healthcare. Is it just the combination of your skills and interests that kind of pushed you in this direction? How'd you find the internship? Talk to me a little bit about that.
Yeah, it's a really good question. So I actually kind of developed that interest in healthcare due to my mom. She'd always dealt with like really severe health issues, and she was always like suffering. And just seeing her have to deal with that was awful as a kid, but I can only imagine how bad it was for her. And I know that she put on a strong face, but I wanted to do something about that. And then when I was in college, I really was able to explore engineering, and I really fell in love with coding. For context, my whole family is full of people that work in tech. It was kind of in my DNA. So being able to merge my two interests by finding this internship at back then at CapRX really was one of the luckiest things that ever happened to me. And I'm really fortunate to be able to work here now.
Well, you know what they say, it's a kind of preparation plus luck, right? Equals landing it. So it's a powerful story. It's great. Thank you for sharing that. Lisa, how about you? What got you interested in healthcare and health tech along the way? I think this is interesting because the last time we did an episode like this was a while back, and it was specific to our pharmacists and, what a sort of a path to a non-traditional healthcare career could look like for a pharmacist, non-traditional being managed care versus, retail pharmacy or an institutional pharmacy or something like that. So Lisa, the question, I know I'm rambling a little bit. I do that sometimes. What got you interested in healthcare, health tech? And did you always know you wanted to work in healthcare, or was there something that triggered along the way? And how'd you kind of find your path to the internship?
I always have the biggest curiosity in the healthcare industry. Like, I'm an international student. I came to the US when I was 16, so 10 years ago, approximately. And when I first came, like, all the insurance, the healthcare, the pharmacy are really different from how is it like in my home country. So when I first came here and navigate myself when I need to go to the doctor or something, I took a lot of time to research on how is it like here. And that's when I first got very interested in this field. And a year after my grad school, when I was applying for internship, I saw this amazing opportunity on Handshake, and I was like, "Oh, that's perfect." It's a combination of healthcare and also with like coding, something that I enjoy doing a lot. So yeah, immediately applied and really happy to be here to continue working on Judy Health. There's also something like I know like traditional PBM in the US are so not transparent. So it's really amazing that Judy Care is the first one that can conquer that. So I'm really happy to be part of this journey in the future as well.
Nice. And I love hearing how you found it too. It's helpful. I think people can probably relate or help them look for new opportunities. Jacob, you have a little different angle, which is great for this show. You graduated, you spent some time in management consulting, and then you focused on a healthcare MBA. So talk to me a little bit about that and then how you ended up in the internship. And then we'll see where the discussion evolves from there.
Yeah, of course. So for me, it started similar to Brian's story with a family connection. So my mother and my grandmother were nurses for their entire career. So I kind of grew up hearing stories about what's like on the boots on the ground healthcare provider side. Now through high school, I was never good enough at science to think that I could make a good provider myself. So I didn't seriously consider healthcare as a career opportunity because I wasn't aware at that time of how diverse the field is and therefore how diverse the problems are and all the different skill sets that are required to solve those problems. So when I started management consulting, working on problems more around organizational and bureaucratic management, I got the chance to have a couple experiences that touched on healthcare, and I really saw a path that I could be part of the solution. So that led me to wanting a healthcare focused graduate degree, which I loved and got everything that I wanted and more out of that, the UPenn healthcare management major, and heard through that academic program about Judy Health. So it was very natural stepping stone to come in and try and explore. And I think that's one of the things that has fascinated me the most about working here is that you have people, even on this call between us, Lisa having data engineering and data analytics background, Brian with the coding and tech development. I'm more on the policy side. I know we have our managed care PGY1 residency for clinical programs. So even for very early career individuals, I think Judy Health is very intentional about bringing a wide variety of experiences to solving problems in this space, which is necessary and I think very refreshing.
Yeah, it's pretty awesome. It's humbling for me too to be able to chat with everyone. And I usually joke that we have our own expert network as a leadership team here. I put up my hand over a decade ago just to cover healthcare topics for investment research purposes. And here I am today. It's kind of wild how we all end up in these seats. So I'm going to go with a fun one now. What advice would you give your college self, quote unquote college self, about the process, interviewing, going full time? Anything you can share that you think, based on what you would have told yourself, would help the next generation of students navigating the system to find themselves in a quality internship and hopefully going full time? Lisa, I'll start with you. What would you tell your younger self, which is not too long ago, I know, but still?
I will tell myself to like for the interview section, like do a nice homework on what the business is like, especially for such a niche industry instead of one of the bigger one out there. Do your homework on how the business is like and know what the goal is. I think that is a really nice plus on top of your technical skills if you're applying for technical roles. And for the intern process, I think intern period is a good time for you to ask dumb questions. So ask a lot of questions to your team and like people here are really helpful. They are always open for questions and no questions are dumb questions here.
Brian, how about you? What advice would you give your slightly younger self about the process and finding your way to an internship and a full-time position?
I'd say to be open to working at startups. I think especially wanting to work in tech, a lot of people really hone in on like the hyperscaler, the multi-trillion dollar companies, because they have like these well publicized, very high salaries for internships and full time. But I think that I would highly recommend that more people take the risk and work at early, mid, and late stage startups. I think that these companies are the ones where you can really prove yourself to be useful to the company and also learn way more than you would working at a big tech where you're very isolated in a very small system. And also in terms of compensation, right? I think that working at a company like Judy Health, if you work hard, if you deliver, you're paid well. And being able to have that kind of control over your destiny, over your what feels like your worth is really rewarding compared to the very structured, very rigid levels of these huge companies.
I think it's an interesting perspective. I like hearing that. I do think that goes through people's minds. Hey, okay, this is a startup. How well established is the company? And they're comparing their options. And I think you see a lot of, sometimes there might be pressure. I don't know. What do you think? Is there peer pressure in that regard where it's like, oh, I'm going to interview over here and you're kind of keeping up with the rest of the class and you're kind of saying, don't do that.
Yeah, I think a lot of people try to maybe want the name recognition. When I was talking to my friends, a lot of whom weren't very well versed in the healthcare space, a lot of them didn't know who Capital RX or Judy Health was. But when I was able to like tell them the work that I was doing and the scope that I had, a lot of them asked for referrals, which was really nice. And being able to convince a lot of my peers just by telling them my experiences was really nice.
Jacob, same question to you. What would you tell your younger self about this journey?
I would say that in healthcare specifically, and I'm sure this is true about a lot of other areas, the amount that you know about the domain, the topic area, the field can be equally, if not more important than the technical skills you bring. Technical skills are also very, very important, but I would say similar to Lisa's advice to really research, do your homework on the company that you're working for. I think it's good to be curious and to spend time reading and learning in general about how the various healthcare systems interact with each other. What are the friction points? What are causing those friction points between those systems? So in our case, it'd be between plan sponsors trying to deliver quality benefits to their members against providers who oftentimes, especially on the medical side, are margin constrained themselves, drug companies who are trying to fund innovative research for additional cures. Because when you get into a company in both the internship stage and early career stage, being able to frame all of your work in the context of the problem space becomes very important to your ability to perform, but also your ability to derive meaning and satisfaction, understand how you're part of the solution. So in summary, I would say technical skills are important, definitely learn them, but also don't discount the value of knowing the field.
So I'm hearing a lot of, if you could go back a little bit or a handful of years in time, you'd have done a little more research about the company, the industry you were going to interview. And that's definitely good advice. And then I like to kind of trust your instincts or be willing to take a risk from Brian. So that's cool. You guys have been generous with your time today, and I love the answers so far. I think I'm going to jump right to the last question because I know everybody's busy. This has to be safe to share. It's the most astonishing question. Compliance hats on. So tell us a good, quick story, like the most astonishing thing you've learned about healthcare since joining or during your internship, or that you're most excited about working on. Again, safe to share, just a good, quick thing that you've kind of picked up along the way since you've come on the team that might be helpful to the audience. How about Jacob? Stick with you. You go first.
What has struck me more and more every day working in Judy Health is how radical our commitment to transparency is. And the reason I think that's surprising is I think particularly in academic settings nowadays, it's kind of table stakes that every decision needs to be data driven and you need to use all available information to make a decision. So then when getting in this space, hearing from brokers and clients about how they're hamstrung in their ability to do that because existing legacy vendors treat clients' data as proprietary on their own. And even despite lawsuits and court rulings, still find ways to fight giving, for example, plan sponsors access to their own claims data for their own members. If you were in a textbook setting, right, you would get a problem set in your economics or your statistics class. Here's the claims data for your members, find the highest cost procedures or drugs, come up with strategies. And the fact that Judy Health has a commitment to not only providing and passing through all of the client's information that we have, but also better enabling federation of that data and making it more useful, particularly as we talk about Judy Health and combining the processing of medical and pharmacy claims on the same platform, how much that will just unlock value for our clients by the nature of giving them access to the raw material they need to build the best solutions.
Yeah, it's a good one. I mean, we talk a lot about access to data, and I like the context you put it in there. It is surprising that it's still such a problem, despite all of the effort people put into getting their data and using their data. It's a little harder than it should be, to say the least. Lisa, how about you? What's one astonishing, surprising, interesting thing you've picked up along the way between your internship and here that you can share with the audience?
Before joining Judy Health, well, I didn't know what a PBM is at all, and none of my friends will know that either. So, coming to here, knowing that the traditional PBM method was out there for decades, and that's making both patients, pharmacy, and insurance are unsatisfied with how it is. And I think it's really amazing that how Judy Health is able to start with the flat fee and with the subscriptions to fix that problem. So I think that was one of the astonishing thing I found here.
Very cool. It's amazing how many people say that at the beginning of their, what's a PBM? AJ talks about that all the time when he first got, he's like, what's a PBM? Coming at it from the pharma supply chain side of things. And Brian, same final question to you.
Yeah, in a similar vein, I mean, growing up, I often hear my parents talking about how expensive healthcare costs were. And I think we all just took that for granted. We often saw it as a black box, something they couldn't peer into. And after working here, it was really quick to see how much fraud, waste, and abuse there was in the industry and how aggressively Judy Health was pushing back on it with a radical transparency. I think it's very rare that you can say that you're working for one of the good guys in the industry. And I think that working here has really allowed me to work in an industry that I'm very passionate about, enjoy the big picture, but also the day-to-day tasks, but also say that I feel like I am genuinely helping the American healthcare system that is so broken.
Love hearing that. Brian, thank you. Lisa, thank you. And Jacob, thank you for taking the time today. Enjoyed hearing your stories, your paths, your advice. Look forward to working with you in the future and seeing how things evolve for us here at Judy Health.
Yeah, thank you for having us.
Thank you.
Pleasure, Justin.
Thank you for listening to Astonishing Healthcare. Head over to judy.health and visit the Insights section for show notes and other relevant content. If you like this episode, be sure to subscribe so you don't miss the next one. And definitely share the link to this show with your network. Have a great rest of your day.